Well, it's time to just have a little chat, you and me. Let's imagine we're going to grab a cup of hot cider or tea or coffee, whatever your favorite winter drink is, and just sit back in a cozy spot and have a little chat. I have a few things I want to share with you in this very brief episode. You're listening to the PHEC podcast, episode 384. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. During this time, a lot of you are taking some pauses and enjoying family and holiday season and just some much needed rest. Some of you are just working through. No judgment. I just know that this is typically a slower time where people will pause and take a break and rest. For me personally, I am doing some work, not much. I am slowing down a bit. My team is taking off during this holiday, the last couple of weeks here of the year. We've got a staggered kind of a schedule with team taking some of their much needed time off and resting and enjoying family. And by the time you hear this episode, this is going to be released on December 24th, which is Christmas Eve. So I know that for my family, I will be in the middle of nursing some family members back to health. My husband has major surgery. Again, I'll record these in advance. So his surgery is the Friday before Christmas. And so the week of Christmas, he is not going to be able to do much, not even eat much. And then my daughter-in-law is also having surgery. So she's got to take it easy. And, they've got the two little kids who are super active. So between my son kind of looking out for the kids and his wife and me trying to look out for my husband, we're having a very quiet Christmas around my family, my house, but the other kids are going to be around. And then it's also just a very mixed emotional kind of a phase of time for us. The holidays can be very triggering for a lot of things, and no matter where you are, but you all are aware that we are in this really interesting journey of grief and having lost our son a few months ago and the tragedy of that. And it's just a thing that we've decided we're just going to feel all the feelings, and we each have our own, therapist and support. And then we together come together, we have support together and individually is what I'm trying to say. So we can individually work on ourselves and then, get some support collectively. But even with all of that, there's just a part of this that we just have to walk through. And, it's not something that I'm not going to always bring up and talk about, but I do want you to know that we're okay. That doesn't mean that we don't have moments of real sadness and crying and tearfulness. And it's very hard, extremely difficult. The reality keeps hitting us like, oh, that really, and it feels like, I almost want to say that really did happen, as if we're waking up out of a dream, a bad dream. But then there's sometimes we just are consumed with so many wonderful, wonderful memories, and we laugh and then we flip over and cry. We go from laughing and crying constantly. But I think that's, for us, it's healthy processing. We just have these times, and it's not just me and my husband. It's our other kids. It's our whole family. So I'm bringing all that up to just kind of, point out that holidays are just a mix of everything. For us, that's what it's describing this year. And then for a lot of you, I know that, insert your own situations, and it just could be a very mixed bag of things. So take the break that you need, do what you need to do to take care of yourself, enjoy the season however you enjoy it and however you celebrate it. And I will say that I really appreciate you all. I don't think I can say that too much because you are an amazing community, public health colleagues, friends. Some of you are so generous with your prayers and thoughts and messages. And we may not have even met. And when I say it like that, some people I have met and I've, received hugs and I know you. And there are some people that generously feed into me and my family with wonderful, warm thoughts and kindness that, we haven't met only through this podcast and the connection. So I just want to say thank you. Thank you for an incredible amount of support during a really tough time for me. But beyond that, just all of you who have just really stepped up in public health and for all that you do for public health. This is almost like a tough fight. We've been knocked down. We keep getting back up. You all are doing some amazing work in public health. You're pivoting, you're changing, you're not giving up, and you are fighting for people and their health and improving health and outcomes for people and populations that you care about, regardless of how difficult it may feel. I thank you for the support of your loyalty for listening to the podcast. I hope that you're excited about the things I've been mentioning in the last few episodes that we're doing as we're, turning the corner and going into a new year. I have a whole new sense of renewed energy in what I do, the work that I've been doing. And I'm excited about that going into next year. And I hope that some of that spills over on you. And I'm really hoping that some of your enthusiasm for next year will spill over on me and we can keep each other, motivated and encouraged during these times. Overall, I just really wanted to take this time to again say thank you, let you know how much I appreciate you all for over 7 years of support with this podcast. And all the people that I've talked to and the conversations that you had the chance to listen to, the people that I've interviewed have been my guests, and the conversations that you've had the opportunity to listen to, all that I've learned about this whole industry of podcasting and producing the Tribal Epidemiology Center's podcast and supporting the tribal organizations and communities. That's been such a delight. And our new podcast that we produced, the Public Health Entrepreneurs podcast earlier this year, where you have a whole separate podcast that you can listen to topics of interest for public health and entrepreneurship. It's been a tremendous year of growth despite all the tragedies and the setbacks and things that we've had. We've still had such significant growth. So my friends, rest, regroup, enjoy this holiday season in whatever way you choose to enjoy it and whatever it means to you. I appreciate you all. And I am resting, even though you're hearing this is pre-recorded. So just know that as you're listening to this, I am resting and taking care of my family. And we're, going to get through this season together. And I'm going to enjoy my grandchildren as well, because I get to have them on Christmas. And I did not have them on Christmas Day last year. So this will be the first time for me to have my grandchildren on Christmas Day. So that's super delight. My granddaughter is 1. And my grandson is 3. Some of you remember Jason. I always call him by name. My granddaughter's name is Kiana. We nickname her KJ to her initials, her first 2 initials. So I'm looking forward to that time with them. So I just wanted to share that with you. And I'm very excited about what we have coming up. So I hope to see you again very soon as we move into the new year. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.